Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know how to make the most complex patient case simple, you need to tune into this episode. Before I go on to the podcast, what is new? What's better in life? Uh, Everything. But I have to share some awesome news. My daughter, Alex, who's 5, is currently working on her chokeholds. What I mean by that is, she's really into jujitsu. Somebody asked her recently, and this got me by surprise. They said, what's your favorite sport?" And right now she does gymnastics and jujitsu. And out of all things, she said jujitsu. I was super surprised. And I don't know the name of the move, but basically she was on her back and there was an athlete on top of her. She straightened her legs in almost like a inverted long sitting position and then tossed him over, rolled onto her back and put her in a chokehold. So she loved that and she got that feedback. Unfortunately, I'm the practice dummy for these chokeholds, so it's been interesting uh, to try these out at home. I'm new to the sport. Right now, I'm not enjoying it because I'm the one being choked out. But yeah, so that's what's happening with her. My son Jacob is doing awesome. For those who've been listening to this podcast for a while, I'm watching him grow. He's 2.5 years old now, and my wife and I had an interesting conversation. And when is it that our son he's so pure, like he just wants to be loved. He just wants to like enjoy life, and just it's an easy world, right? He just plays all day. And at some point, that innocence starts to drop, and then attitude comes in and other, foul language, or they want to start doing things that are a little maybe outside of what your comfort zone is. And we're having a conversation of like, when does that really start? Like, when does what time or day, or sorry, what age does that really turn and pivot? And we came to the conclusion it's around 5 or 6 years old, and it's probably because one, the maturity level, but also they start going to school and they start meeting friends who like to talk about these things and really do it. So we're enjoying this time while he is at a young age where he just literally just wants to be held and loved. So other than that, I am for those of you in San Diego or remote, you might see on my Instagram. I'm working out in a lot of different places nowadays. I'm all over the place. I'm just enjoying, variety, meeting more people, and getting a different flavor of different programming. So, just battling a little bit of knee tightness, but everything is good. All right, on to this podcast. Why am I talking about complex cases? Okay, so I'm currently working on a new program, a template, if you will, for sports physical therapists. I get the question all the time. How do you manage low back pain? Like, what's your secret sauce? What am I missing? What is the thing that's really going to help people? And so, low back to a lot of people can be complex, and I want to make this super simple for you. It's going to be easy. It's 3 steps and I was working with my team on this, and we're working on the program designing, like what it is that you would do to apply to any framework, whether that's sciatica, whether that's what any form of back pain, chronic, acute, whatever it is. So if you're hesitant or scared about low back pain, or you don't enjoy it, or you want to refine it, this is a great episode for you. If you want to be able to apply this to shoulder, knee pain, neck, whatever it is, this is going to be fantastic. But I'm going to break down how to approach a hard, tough case, or even the simplest, with an easy framework that I promise you you're not using. You are not using it at all. And the minute that you hear this, you're going to be like, well, that's simple. That's easy. Why am I not using it? It's like a duh moment. It's like, come on. How are we not seeing this? And I'm going to make it super simple for you. So I'm creating the program, creating the protocol, creating the templates for you guys, and I'll release that later. But ultimately, it's what would you do to simplify the process? What is it that you're doing that you're second guessing yourself, you're making it complex, and you're making it too hard? I promise you, you're not seeing these 3 things. So let me start. All right. Whenever you're working with a case, people say, "Well, it's a region." Like I have knee pain, I have back pain. All right, I'm gonna have you take a step back, and in order to make this complex, what you typically do to make it more complex is you go straight into the source, right? You're trying to figure out what it is that's causing it, right? And then you look for, what is behind the scenes, that what movement, what tissue, what everything else that's influencing this. Now, what I'm going to do is I'm going to take you, I'm going to take you out of your element, and you're not allowed to be a physical therapist right now. All you're allowed to do is listen to the case. You're not allowed to see them, right? So for instance, if can you solve a case on paper without actually seeing who they are? That's what we're going to do right now. So I'll give you a case, and you're not allowed to think about what exactly is causing it. You can't talk about a meniscus. You can't talk about, a talar dome. You can't talk about an acromion process. You can't talk about any of those things. You can't talk about a wing and scapula. You can't talk about any of that. Now, let me give you a case. You've got a 52-year-old male who works in construction, who enjoys going to the gym before work. And his form of construction is he does concrete, and he's bending often, but he's a gym goer. He enjoys going to the gym 5 days a week, and he has a heavy labor job 5 days a week as well. And this person is they're in shape. They're mesomorphic, but a couple extra pounds. So they could lose a little weight, anterior pelvic tilt, and they're relatively fit for their age. All right. This person has sciatica, and they want to get rid of it as soon as possible. It's been bothering them for a year, and they don't know what to do. All right. So that's the case. Let me break this down for you. And that's probably somebody you might see in your clinic. And then I'll also break down an athlete. I'll break down three cases to you today. We'll do a 50-year-old construction worker. We're going to do a 16-year-old youth athlete, and we're going to do a 30-year-old pro athlete. So I'm going to give you cases that all of you may or may not see in your clinic, so you can put this in context. All right. So we said that's the 50-year-old. Let's call him Steve. So Steve has the low back pain with sciatica. And then we're gonna do Joanne, who's a 16-year-old volleyball player who just had an ankle sprain, and it's her season. She's a senior in high school, and this is her chance to be able to play her last season. She's not going to be playing in college, but this is like her final season, and it's the last game of the year. And she just twisted her ankle, and she has 3 weeks to get back to full play from a grade 1 ankle sprain. And then we have a 30-year-old um, basketball player who's a pro athlete who's been battling knee pain, and they need to be able to get back to full play within 2 months. All different scenarios. And the regions. So we have Joanne with the ankle, we've got Steve with low back, and the basketball player, let's label him Mark. So you have Mark, Steve, and Joanne. All right. Now, all of you might think, okay, well, how do I solve these cases? I mean, they're all different scenarios. I'm going to give you um, the three things on how to structure your approach to these individuals. Here's where you go wrong. How does it hurt? When does it hurt? What makes it feel better? Define your pain type: clicking, stabbing, achy, dull, sharp, throbby. Got it. Uh, and then you want to go to the special test. I want to test it. Boom, boom. And you're like, oh, it's a meniscus. Well, I know meniscus takes 8 weeks. So it's a meniscus tear, the lateral posterior horn, and it's going to take 8 weeks. And then you design a home program. So this is where you're going wrong. So the first thing you have to do is instead of categorizing where the region is and what type of injury it is, I want you to think about one. Label the first thing you need to do is label the phase of healing. It is the most important thing to consider. The most important thing. Why? Because it dictates so much. Ready? Now, most people in an orthopedic setting might only see people who are in the chronic phase. If you see people in an acute injury phase, that's usually in the first 2 weeks. Now, if you are in a state which has direct access, that's a little easier. But if you work in an ortho clinic in a direct access environment that doesn't get a lot of referrals for acute injuries, you might not see them. So, your classification, you may see things in the subacute phase or in the chronic phase. So you have to start there because that dictates what your approach is going to be and how aggressive and conservative you're going to be. So phase of healing, acute, subacute, and chronic. In the acute phase, typically 0 to 2 weeks. Subacute, 2 to 4 to 6, and chronic is six months and on. And now you can label chronic on its own, right? You can have somebody 3 years of chronic pain, but somebody in the remodeling phase would still be considered chronic pain, chronic healing phase. So now that you have remodeling happening, you have to decide how you're going to approach this individual. Somebody in remodeling, you could be a little bit more aggressive because their tissue is healed, and you can push a little bit more. Somebody in the acute injury phase, you just have the proliferative phase. You have an instance where you have a riskier situation. Their healing is not complete. So, yes, you can help influence the type of healing, but then also you have a riskier time point that if you push them too hard too soon, you can set them back very quickly before they hit the remodeling phase. If you're in subacute, you're in that middle gray zone. So, acute injury phase is kind of like a red light. You have to be very, very careful. Subacute's kind of like a yellow light, and then chronic is in the green light. So you can have a little bit more fun with somebody who's in the chronic phase. You can push them a little bit more. Somebody in the acute phase, you really have to be careful. Now they're in the 2 to 4 week mark. They're still healing. That gives you the framework. So when we talk about Steve, Steve is in the chronic phase. He's had it for a long period of time. That's going to dictate how we treat him. Joanne is in she has 3 weeks to return to play. You just saw her day one of injury. So now you're in the acute phase going to subacute. And then you have Mark. Mark is an individual who has to return to sport in 8 weeks. So he is currently in the acute phase. Now you're going to be able to get him to the chronic phase. So that gives you a little bit of context. You have acute, subacute, and chronic. We have all three cases at the moment. And this gives you a framework. So that's the first thing you're going to do. Okay. The second thing you're going to do is what is my timeline to return to sport? So, for instance, uh, Steve doesn't have any return to sport criteria. He doesn't, he just needs to feel better. In his mind, it's just as soon as possible, right? But he doesn't have a timeline. So on that person, there's less pressure. We know how to manage that. Joanne needs to be able to go back quickly, right? We said 3 weeks for her. So that has a very short timeline, and she's on the acute injury phase. Mark has an 8 week timeline. And so that's less urgent, and they're in the acute phase. So with each of these individuals, who has the highest pressure and most delicate case? It's Joanne, because she's in the acute phase and she has 3 weeks to return to sport. Then you have Mark, who is in acute phase and returns in 8 weeks. And then you have Steve, who is in the chronic phase and has no timeline. All right. Now that we've established acute, subacute, and chronic, you've established that what their phase of healing is. You've established what their timeline is. One of them is urgent, the other one is in the middle, and the last one doesn't have a timeline. So now that changes. We haven't even evaluated these individuals. Now it just puts the context of what am I dealing with here before I make a decision on what I'm actually going to do. And the last one is, you ready for this? If you haven't heard my podcast before, there's something I have that I created called the patient bell curve, the athlete bell curve, and all that means is life is in a bell curve, right? Most people, most things fall in 80% of a general framework, a general timeline, a general approach. But you have instances where you have people on the right side of the bell curve at 10% and the left side of the people at but 10%. And what that means is you have a lot of athletes who are pro athletes. Those are very high activity. They know what they're doing. They have good healing rates. They're motivated, and that's the right side of the bell curve at 10%. Those 10% of people are just super active. They're almost too active, and you have to control how much they actually do. It's not pushing them more; it's actually slowing them down. At the opposite end of the spectrum, you have, your couch potatoes, your people who don't exercise a lot. Those people just need to move more. So you have 10% on the right side, your pro athletes, you need to slow them down, and then 10% on the left side, your couch potatoes, you just need to move more. And then everybody else falls in the 80%. That's kind of like you and I, depending on your fitness activity level. We do enough to create a stimulus, to create stress into our bodies, but we manage it carefully and we're not doing too much or too little. We're kind of in the middle of that bell curve. And now that dictates how you're going to approach your patient or athlete, where they fall in that bell curve. So you first assume you figured out what phase of healing they're in. Number two, you figured out the timeline to be able to achieve that target. And the last one you're going to figure out is where do they fall in the bell curve? So let's say Steve. Steve was a construction worker who enjoys going to the gym and he does a lot of heavy manual work. Now, what you might say is he's definitely not a couch potato because he has a heavy duty job, but and he also goes to the gym 5 days. So he's probably in the 80%, but you might even say, well, maybe he's doing too much and that's what's causing him. So he can be like maybe closer to the right side of the bell curve, but probably in the middle to the right. Then you have Joanne, who's a high school student, and they're a senior in high school and they play volleyball. They're probably very, very active. So they're in the middle of the bell curve, maybe closer to the top 10%. But in either case, they fall in the middle to the right. And then you have Mark, who's a pro athlete, who is definitely on the right side of that bell curve, playing basketball probably several times a day, 6, 7 days a week. So he's on the right side of that bell curve. So you have people who are in the middle to the right in this case. So let's put this in context. Now that you've discovered that, you now have Joanne, who is in the acute phase. She has an urgent timeline, and she falls in the middle to the right side of the bell curve. You have Steve, who's a construction worker, who's in the chronic healing phase. They don't have a timeline, and they're in the middle to the right side of the bell curve. And then you have Mark, who has a acute injury, and they have a moderate timeline, 8 weeks, and they're on the right side of the bell curve. Now, what you're asking, Chris, what does this do for me? How does this help my clinical practice? Well, you now can go into the evaluation and creating the plan of care for someone, knowing the context of what you're going to treat for how long and how you're going to manage this case. Here's how a lot of ortho PTs manage cases without playing any context to it. You have knee pain, meniscus tear, posterior lateral horn. It's going to take 8 weeks. I don't know what's going to happen on week 2, 3, 4, 5, or 6 that's going to get you back to your playing soccer. So instead of telling you that, I'm going to tell you, you know what, let's just take this week by week. And I don't want to flare it up. So come back next week and I'll promise you that I'll give you more to do, but I'm not sure if I'm going to give you a direction. I'm just going to tell you based on how you present. So there's zero forecasting. You're a reactionary PT and you're waiting for things to happen and you avoid planning because you don't feel confident about that timeline's going to be how well they're actually going to get better, how much better they're going to get, what in what fashion, how quickly. And so by giving this framework, it gives you the path and the roadmap quickly without even have to think about it. So if you were saying a lateral knee meniscus tear, in the posterior horn, and it's going to take 8 weeks. Now you can put it in the context. Now you know what phase of healing it's in, so you can say, "Well, hey, I'm going to have to be very delicate with this case because it's an acute injury. I know that he has a short or immediate timeline, so I know that 8 weeks is not possible. I'm going to have to figure out how to shorten that down." And where do they fall in the bell curve? They're very active. So what that means is I'm actually going to have to slow them down So you're gonna have to quality control their workouts. You're gonna have to quality control what they do. You almost have to treat them like they know too much, and you have to bring them down. An individual who's a couch potato, you just need to give them to move more. And maybe that's what you're used to in a clinic. You're just used to giving people more. But with a pro athlete who has a short timeline or a moderate timeline and they're in the acute injury phase, more is not better. Less is actually better. These people train too much. You tell them to do something, they're going to do it multiple times a day. And now they're going to add that onto their existing training regimen. You're almost going to overload them. Now they have a short timeline. You're in a delicate phase. You don't push in the acute injury phase. So, what this does is it helps you reduce how much mistakes you make and the risk of re injuring somebody in a very critical timepiece. I said you can do this in 3 steps. Let me give you a bonus. The next thing you have to do is figure out, what am I going to do to solve this person's pain in 2 fashions. Number one, what are you going to do immediately to reduce their pain? And then what are you going to do from a long-term perspective to ensure that their pain was reduced 3, 4, 5 weeks from now? Now, PTs, we generally think, well, let's solve your pain by fixing your movement, which movement we know takes 4 to 6 weeks to clean up and another 4 to 6 weeks to gain some like foundational strength on. So 12 weeks later, we're like getting them strong. What if somebody has to get back to sport in 4 weeks? Well, you don't have 12 weeks. So how do you consolidate this? Well, movement's going to take 4 weeks. So that's a delayed. So everything we focus on from a professional standpoint is delayed. We know it's a long-term benefit. Movement is a long-term benefit. You're not going to clean up someone's movement in 2 to 3 days. Yeah, they'll demonstrate it, but it's not ingrained in them. So you have to think about two things: immediate and long-term improvements. So what are you going to do right now? If somebody has to go back to sport in 3 weeks, what are you going to do to manage their pain now? Don't give me a fancy exercise with movement-based pathology and implications, because that's going to take me 4 to 6 weeks for that to get ingrained. Now, if you feel good about yourself and you say, "Hey, they moved well in the clinic," you pat yourself on the back. That didn't do anything for them on the soccer field, because that takes 4 to 6 weeks to be minimum to be ingrained, 10,000 reps. So that's a long-term benefit. Once you've made out your plan of care and you like give them exercise program, but they need to get out of pain now. So what are you doing now to reduce their pain? Manual therapy. That's great. That reduced their pain for 48 hours, 72 hours. But what are they doing managing at their home to manage their immediate pain? How many times are you seeing them? Do you need to bring them in more often? 3 times a week instead of two. So you can manage their pain quickly while you work on the long-term benefits as well. So 3 easy steps with a bonus. Ready? Figure out their phase of healing. Number two, figure out their timeline. Number three, figure out where they fall in the bell curve. And bonus, figure out what you're doing immediately and long term to manage their pain. And once you do those four, you can frame any single patient case you've ever thought of. Give me your. This is why, if you guys are going on my YouTube channel, I have something called whiteboard sessions. Whiteboard sessions is where I originally started with just me working with my team, and I would go through a case, and I use this exact same timeline, like this framework. And I said, give me your hardest cases, and we're gonna run this through. What are you doing immediately? What are you doing delay? What's your phase of healing? Blah blah blah. And I gave a course, and one of the students, while I gave the course, I did a whiteboard session with them. They're like, "Hey, is there any way you can film this when you do these? Because it really helps me navigate patient cases." And I said, "What part of it?" They said, just a framework. Can you video that? So I started videoing them, and so I started posting them on YouTube. It's on one of the folders. It's called whiteboard sessions. What I'll do is I'll put these four categories, or the three with the bonus, and I say, give me your hardest case possible. And everybody can be solved in this, whether it's back pain, knee pain, hip pain, it doesn't matter. But because you naturally go to the source, the best way I can describe this, you ready for this? Like whatever you're doing, just pause right now. I want you to process this. Think of the person and not the region. My framework is helping you figure out what type of person am I managing versus what body part am I managing? And that's how physical therapists talk. What body part? What body part? Tell me about it. I don't want to know the body part. I want to know the person because I can solve that. And then you can work all your magic on everything that you've ever learned in CU courses, manual therapy, whatever it is. So any tough case can be solved with these 3 calories plus the bonus, right? So let's solve Joanne. 3 weeks out, what are you doing? 3 weeks out, acute injury, short timeline, and middle to the right side of the bell curve. Ready? What are you doing immediately and long term? Immediately, you're probably going to put a brace. You're going to tape that thing up, do some soft tissue, do any form of modalities inside the clinic just to get them pain relief. And then long term, you're probably working on their balance. You're probably working on like, their stance positions. You're going to progress into plyos, return to running, work on neuromuscular control and deceleration, blah, blah, blah. But those are all delayed. But this person's still in your clinic with pain. So you have to be able to manage them. This is where modalities, tape, bracing, all these implications are fantastic. So you have to be able to use modalities early on with your long term and put that together inside a plan. And now what you're going to do is probably see them 3 times a week for the next 3 weeks. So that's 9 visits over 9 weeks. And generally, and this is just a general concept, but I tell people you probably are going to improve 10 to 15% every single week, no matter your case. So if this person's at 0% function, probably going to be around 45, 50% improvement in the next 3 weeks. Now that helps you say that with confidence and saying, hey, I'm not really confident, so I'm just going to tell you to come back next week and we'll just take it week by week, right? We'll just progress little by little. We'll see how good you're going to get. No, you probably get about 15% every single week. 15 times 3 is 45%. They're going to have 45% improvement in 3 weeks, and they'll probably be able to play half the game. They won't be able to cut very much, but they'll be able to do linear work or might not be able to jump if they're a front row hitter. In either case, you're allowing them to participate, not promising that you're going to get them 100%. And that's where I think you put the pressure on yourself. Let's go with Mark, the pro basketball player. This individual has 8 weeks. So if we do 10 to 15% every single week for for 8 weeks, it's about 95%. That puts you at, yeah, in 8 weeks, I can get you about 100%. I'm very confident about that, purely on math. Now, what are you going to do short term for pain relief? You're going to do the modalities, the taping, the bracing, all those other things, and then you're also going to work on fundamentals, like balance, deceleration, landing, strength, all the above. So you're going to do probably 3 to 4 weeks of neuromuscular control and pain relief, and then 3 to 4 weeks of strengthening and return to play. You'll probably put return to running in 4, 5, or 6 weeks in, deceleration, multi-directional around 5 or 6, and return to practice around 7 or 8. So there's your framework. But it's all dictated by the 3 things plus the bonus I just mentioned. Now, the last one I said, Steve is a construction worker. You're going to have to figure out this is the tougher ones because they have a lot of workload inside their work functions. So now you have to figure out what they're going to do during their work, how you can modify those things, what you're going to do to modify this individual. This person is in the chronic phase, so they don't need a lot of passive modalities, early things, because they're not in a lot of pain urgently. So these people are predominantly probably you're going to do some McKenzie work, you can do some manual therapy, you can do some hip mobilizations. You're going to teach them hip hinging, all the neuromuscular control, which is going to take 4 to 6 weeks. Then you're going to strengthen them for 4 to 6 weeks, and then you're going to return to like gym activities and modifying deadlifts at a higher rate. In either case, you're at 10 to 12 weeks for these individuals. At 10% improvement with a chronic individual, that's easily 100% by week 10. So this person, they have any timeline, all you say is, listen, in 10 to 12 weeks, we'll get you better. It's easy math. It's not hard. Just get their pain down in 4 to 6 weeks, work on neuromuscular control, but it's all dictated by the person and their scenario. Physical therapists don't think about the scenario of the person. They think about the body part and the region, and they fail. Most of your outcomes are failing because you're not taking this bigger, wider lens approach. Why? Because you're stuck doing the same thing all day, every day, and you don't know how your people are going to improve week to week. So how do you know if you're going to project and help somebody forecast how long it's going to take? 10 to 15% every single week use this framework of the bell curve and the phase of healing, their timeline, and then figure out what you're going to do immediately and delayed. That's not that hard. The minute that you start talking about, well, is it a lateral or medial shift? But who cares? Who cares? What the person wants to know is, how long is this going to take? How long do you expect this to take? And that's where you have the lowest amount of confidence and you don't know what to say. So you say, let's just see how it goes. Let's just see you week to week. And that for you is embarrassing. And that's why you don't want to admit to it. So this framework would give you the confidence that you need to be able to forecast accurately. And then the next problem I get is, well, Chris, I don't know if I should promise this person anything or a percentage. Well, that's your insecurity and your lack of confidence. People don't hold you to that. They're not going to come back and say, hey, it's week 9. I'm not 90%. I'm 78.2%. They don't care about that. What they really care about is progress. And all they want to know is generally where they are relative to where everybody else would be. Now, I've had physical therapists ask me, hey Chris, how good am I relative to other people you've mentored? How close to them and their timelines and everything else? If I say, hey, you know what, I expect you to be an expert clinician within 2 years, and it's 2 years later, and you're like, I'm not an expert. All you want to know is that you're progressing in a rate that's faster than you would have by yourself. That's it. So that's all patients want. They want to know, are they progressing faster at a rate than they would have on their own? And if you're off by like a little bit of percents, great. Who cares? But if you're off because you're not good clinically, that's why you're also avoiding the projection problem. If you're not confident in a region, that's a personal problem. But honestly, you use this framework, it won't let you fail. I promise. I've been doing this a long time. I've mentored a lot of sports physical therapists, and it's a framework I've used in the pro sports. I've used it, but I think I've forecasted. If you guys follow me on Instagram, Chris Garcia DPT, I think I calculated how many athletes, I'm looking it up right now, how many athletes I've seen in 15 years of practice, and the answer was 143,807 athletes. That's a lot of mistakes I've made in this planet. And I can tell you what, out of 143,000 athletes, that's a lot of mistake. Now, that's just like that's not community members. That's athletes. So you have to remember, I worked in pro sports. I traveled the world, so I'd see, people 10 to 15 minutes and just, I mean, for 12 hours a day, and just pump them out. And it's a lot of mistakes that I've made, and I'm not fearful of making those mistakes. And that's probably where you have the most fear. You don't want to make a mistake. I've made lots of them, probably over 10,000 minimum on mistakes that I've made with athletes. And I can tell you this, the lower your risk is, the better your outcomes are. I know that that's counterintuitive, but the thing holding you back right now from making decisions is because you don't have a framework, you don't feel confident in this region, and then you don't feel comfortable giving numbers or percentages because you don't want to be wrong. Now, so the reason why your patients aren't getting better is because of you. That's crazy. It's not because they're non-compliant. It's because you don't feel comfortable or confident. So they don't comply with it because you're not confident. So the way to improve that is demonstrate confidence by creating a framework that helps them understand what the journey is going to be like, project it so they can come back and be like, hey, you were right. I'm 10, 15% better. The minute and somebody knows what that yellow brick road is, that roadmap is, they just follow it to a T. So do you. That's called PT school. Hey, how am I doing? That's why you took the test every quarter and you got an A. You know how good you're doing. Second quarter, you got a B. Now you know you're drifting a little bit more, so you got to study more. Now, if PT school said, hey, let's just take this week by week. I don't know what the next 3 semesters are going to be like. We're just going to see how that goes. How does that make you feel as a PT student? Horrible, because you don't know what the forecast. You're like, I'm not going to this school. I'm not going to do the assignments. I'll go somewhere else. Welcome to the patients at your facility. They don't see that. That's why they don't come back. So if PT school provided it, they gave you a syllabus, they gave you an outline, they told you exactly what every semester is going to be and where you should be according to your grades. If you're not providing that syllabus and that yellow brick road and that roadmap, there's no way your patients are having success. So the success you're having is because the people that you gravitate to and the people you understand, you get them probably in your age bracket, or the people that you like, you have a specialty, you work with soccer players, whatever it is, you can jive with them because you know their scenario. You generally know the phase of healing, you know their timelines, you know their bell curves. What you don't know is, what about tennis players? What about 50-year-olds? What about 75-year-olds? What about people who are pro athletes? What you don't know is you know body parts, but you don't know the people. So instead of developing the body part, why don't you get to know the people? Will help you with your outcomes. So get to know the person, not the body part. That is a framework. That's the end of my rant. I love this stuff, and if I can just if I sat down with you for an hour and I said, hey, let me mentor you for an hour, this is what I'd show you. Nothing more. Not a mobilization, not a technique, not a return to play protocol. I would do this. This is the number one thing that you are missing inside your clinical practice that you cannot get anywhere else. And you are, if you, the minute you apply it, you're going to make some mistakes, and that's where you need my help. So the reason why I built this is because it's the piece that the community needs, the syllabus. You're not providing the syllabus. You do that, you put yourself in a good position. Where do you get to know more about this? Two places. My Kickstarter 8-week mentorship program, which is you need to be attending. It's 8 weeks of clinical mentorship with me virtually via Zoom, going over this. I literally, over 8 weeks, will go over this entire framework to help you figure out what you're missing inside an athlete. I'm not going to teach you a mobilization. I'm not going to teach you a tape job because you don't need that right now. You need a framework to help people figure out how to manage their own pain for the timeline that they have. That's number one. You can register at drchrisgarcia.com/Kickstarter. You can sign up for the course that's starting January 10th, whenever you're listening to this recording. I'm passionate, whether you do or don't, it's up to you. I'm just telling you, I do it once a year. This is your time to take advantage of it and actually develop clinically and not just via tactics. Second part is my academy. This is where I meet this is not for new grads or PT students. It's for people who've made the mistakes. They're looking for something different. If you're a new grad or a student, take my Kickstarter. Don't start in the academy. It's too soon for you. You need to make some mistakes, figure out what's working, what's not, so you can bring me the questions. This is a time for you to develop as a clinician, and I help you navigate the patient cases that are tough, where you are in your professional career. What's your career path? What do you need help with? How do you get more athletes in your schedule? It's higher level conversation. So the academy, drchrisgarcia.com/academy, wherever you are in your clinical practice. Those are going to be your top two things to do. Other than that, you can go back to just treating the regions and having non-compliant patients and athletes or no athletes on your schedule. So I hope that helps. Super fiery at the moment. If you're in my Kickstarter, so you're gonna have to look forward to. This is literally every single session inside 8 weeks for 2 full hours you'll have with me. Nonetheless, I hope you guys are doing amazing. I will see you guys on the next episode. Take care.